This is John. John's wife was diagnosed COVID-19 positive today. Though it seems to be a mild case, John is worried that he may also have contracted COVID-19 and that he may have unknowingly spread the virus to his colleagues at work. John's employer recently instructed all employees to immediately let HR know should they suspect that they have been exposed to COVID-19, and so John alerts his HR department. John is unaware that his company has started using Qode Health Solutions' Lynx HCF COVID-19 solution to help manage COVID-19 in the workplace. Lynx HCF is an electronic medical record or EMR solution that includes screening, testing, and patient care management functionality based on the Center for Disease Control's or CDC's COVID-19 patient care plan. Lynx HCF is available cross-platform as an Android, iOS, and web app. John calls Jane from HR to tell her that he has been exposed to COVID-19 and that he has fever, body aches, and a dry cough. Jane makes use of the COVID-19 screening and tracing module to record John's symptoms and to receive guidance on recommended next steps as published by the CDC. After submitting John's symptoms, Lynx HCF prompts Jane that John could have contracted COVID-19 and that he should telephonically contact a healthcare professional for laboratory-based testing. Jane helps John schedule a telemedicine appointment with Dr. Dlamini through the Lynx HCF virtual consultation module, Lynx Virtual. In the meantime, Jane advises John that he should self-isolate at home while he receives a confirmation of a time and place to go for testing, following a diagnosis from Dr. Dlamini. Lastly, Jane uses Lynx HCF to record the details of all of John's workplace contacts in the last 2 weeks, so she can follow up with them for COVID-19 screenings. Dr. Dlamini is also using Qode's Lynx HCF COVID-19 solution to manage all his COVID-19 patients. Jane can thus, with the consent of John, directly share John's details from the EMR with Dr. Dlamini. After getting Dr. Dlamini's advice, John is able to safely get tested for COVID-19. Dr. Dlamini receives John's test results back from the lab, captures John's test results into the testing module, and lets him know that he has tested positive. Since John has mild symptoms, Dr. Dlamini reports the case to local authorities based on national guidelines and advises him to recover at home in self-isolation. John's symptoms will now be monitored on a daily basis through the daily assessment tool contained in the Lynx HCF patient app, which provides assurance to him, his family, and his employer that he is receiving constant care and that he will be assessed and kept isolated to avoid transmitting to other individuals. John can also get in contact with Dr. Dlamini at any time, should he feel that his condition is deteriorating. Should his reported self-symptoms get worse, he will be contacted and referred for treatment at his closest facility that has been certified as a COVID-19 treating facility by local authorities via the Qode Lynx Facility Readiness application tool. All of John's close contacts at work and at home will be advised to remain at home until they are confirmed to be free of COVID-19. Thanks to the quick screening module in Lynx HCF, the company has now started implementing daily screening for all employees at the workplace. Using Qode's Knowledge Center, Jane and other members of management are able to see real-time automated reports that show them whether all employees have received their daily screening and if anyone has screened positive in the workplace. This gives management peace of mind, knowing that they will be able to quickly identify any employees who may have COVID-19 and mitigate the risk of a workplace outbreak. Qode's Lynx HCF COVID-19 solution is fully compliant with the POPI Act, which means that personal information from John and his colleagues is encrypted and stored securely and can only be viewed by authorized individuals. De-identified aggregated data can be shared with the local health authorities to make sure that the government is notified of any COVID-19 cases identified in the workplace. After a couple of weeks, John is feeling much better, and the doctor lets him know that he is no longer contagious. John goes back to work, thankful that his employer and healthcare providers were able to manage his illness so efficiently and effectively. Qode will share aggregated data within that specific country with the local authorities to keep all data central and complete. With Qode's integrated COVID-19 solution, data becomes a bridge that not only connects the gap left by COVID-19 in the health sector, but a catalyst that links responses to help flatten the curve in communities across Africa. Trust technology. Trust experience. Trust Qode Health Solutions.